Myeloma is a cancer of plasma cells. Plasma cells are generally found in the bone marrow, and they do have a useful purpose in that they produce antibodies to fight infection. However, myeloma cells are plasma cells that have gone wrong. They multiply out of control. They still produce this antibody, but it's an abnormal antibody. It's called the paraprotein. It serves no useful function, but it is a useful marker of myeloma activity. Because myeloma is found in the bone marrow, it affects the bones, it disturbs the bone environment, the microenvironment of the bone, and it causes bone to break down faster than it would normally. So patients often have bone thinning and bone fractures, and we call them lytic lesions. The areas most susceptible to fracture are the rib cage and the bones of the spine, the vertebrae. Patients often have collapsed vertebral fractures, and that can cause them to lose height. Many patients lose 2, 3, 4 inches in height. And it can also cause pressure on the spinal cord, and this needs to be treated quite promptly. And because our bone marrow is our immune system, patients who have myeloma are what we call immunocompromised, so they will have a weakened immune system. The bone marrow is where the healthy blood cells are made, so there will be a reduction in the number of healthy blood cells, the red cells, the white cells and the platelets, and this can cause an increased susceptibility to infection, anemia and an increased risk for bleeding. Myeloma can also affect the kidneys, either directly or indirectly. The abnormal protein produced by the myeloma cell can cause the kidneys to stop functioning correctly, and kidney damage is a common complication for many patients at diagnosis. When bones are breaking down, they can produce excess calcium in the blood, and this again can cause problems for the kidneys. And unfortunately, some of the treatments for myeloma are also quite toxic to the kidneys, so kidney damage is quite common for myeloma patients. Myeloma affects the older population, so 75% of myeloma patients are over 65 years of age. It does affect men more than women, and it does seem to affect blacks more than whites, but we don't know why this is. Unfortunately not. There has been much research to try and identify the cause of myeloma, and we are getting important information about some risk factors, but at this moment in time it's not clear what causes myeloma. It's probably several factors happening at once. As we get older, our immune system is not as strong as it was when we were younger, and we're more susceptible to things that affect the immune system. Researchers have identified some risk factors such as environmental, agricultural, industrial toxins, and there may well be a genetic factor, but it is not a directly inherited cancer like some forms of breast cancer or cystic fibrosis, for instance. It may mean that individuals have genes that make them more susceptible to developing myeloma, but other factors would have to come into play for the cancer to develop. Myeloma is not caused by a single inherited gene like other cancers can be. There is thought to be a genetic link, and we are speaking to more and more patients who have families affected by myeloma. But it's thought that there are other factors that come into play, so it's probably a combination of both genetic and environmental factors. So strictly speaking, most doctors would say that it didn't run in families. Unfortunately, some of the symptoms for myeloma can be quite vague and can often be associated with general symptoms as we age, for instance. As we get older, we expect to have some aches and pains, and back pain and general bone pain is a common symptom of myeloma. And because myeloma affects the immune system, patients get recurrent infections. So recurrent chest infections, urinary tract infections are very common in myeloma. And anemia is another factor, so patients who are anemic will be very tired, very pale, may be short of breath and will feel very weak. Any new or increasing symptoms should be reported to your doctor right away. So any recurring infections that aren't going away easily or are coming back again and again, any pain that isn't being managed very effectively, back pain specifically, do go to your doctor. Any tiredness or generally feeling unwell, your doctor may well want to do a blood test to try and identify what's wrong. There's a great deal of research going on at the moment to try and identify the genetic factors in myeloma so that genetic screening can be developed. We're not aware of the specific genetic factors as yet, so screening is not available at the moment.